Hi folks, welcome to the Pulse of St. Pete's. I'm your host Brian Lamore. On today's show we'll be talking about when is it appropriate to go to your personal physician, maybe the emergency room, or to urgent care. Now urgent care is sort of a new term that a lot of people aren't really aware of. At St. Pete's Hospital they have two locations for urgent care in the Helena area. One is at St. Pete's Hospital and the other is at 3330 Ptarmigan Lane, which is roughly in the Valley or North Helena. And they both provide the same services, but one location might be more convenient to you. Here in Helena, the two locations for urgent care have about 30,000 visits a year. And that means a lot of people need to have this service, and well, maybe it'd be more appropriate for you to go there rather than the emergency room. So we have two wonderful guests here today to explain the difference on those two. First on my left is Dr. Earl Brook. You're a family medicine and ambulatory urgent care physician. Welcome to the show.
Thank you.
Great. And then we have Laura Bennett. You're a PA, physician's assistant. Your specialty is family medicine and ambulatory urgent care also. Welcome to the show.
Yes, thank you for having me.
Well, Earl, let's start with you. Urgent care seems to be kind of a new term that is being used anymore, and I think a lot of people like me might not really fully understand what urgent care is and how that's different than going to the emergency room.
Well, urgent care has been around a little while, and it's basically designed to be a clinic that handles the non-severe emergencies. I always tell people if you wake up in the morning and you say you're really sick and I can't decide if I want to get an ambulance or not, you go to the hospital ER. If you wake up in the morning and you're thinking, oh, I don't feel too good today, but let me see if I can get into my primary care doc, and if you can't get in there, then we're appropriate place to visit. There's a whole lot of spread to that. We have tried to make lists of what's appropriate to come to us and what's appropriate to go to the ER, but it's a tough call sometimes, and we try to help people out with that.
So you'll help them, they could give you a call and maybe say what the conditions are, or they can just show up at your door, right?
Correct.
Yeah. And 30,000 people showing up at the door over a year in Helena, that seems like a lot of use. Now, what's the advantage of an urgent care over the other place? What do you call that? Intensive, not
the emergency room. Yeah. Well, the emergency room obviously is equipped for life-threatening illnesses, car wrecks, gunshots, things that life is in the balance, and they are very qualified for high-level emergency things. We, on the other hand, do lower-level illnesses, lower-level emergencies, and just ambulatory care things if you can't get into your primary care doctor on that day, but you think you need to see a doctor that day, we're the people you want to come see. So.
And Laura, how is let's say an urgent care staffed versus an emergency room? Is there quite a difference in the professions and the number of people?
As far as the number of people, certainly there is a difference. At our urgent care, we are staffed with 3 providers, so often a physician and then physician assistants. We have nurses, we have access to lab and x-ray, but we don't have as many staff as the ER has, because they do have to be ready for life-threatening conditions where our patients ideally are not in that situation.
So it's sort of a convenience. You have some minor medical issues, like an ambulance wouldn't pull up to an urgent care, ideally, right?
Not unless we call them.
Hopefully not. Yeah.
Hopefully not. Yeah. We try to avoid that.
It wouldn't bring you patients, it takes them elsewhere.
It would not, they would not bring us patients.
Okay, that's great.
They do sometimes have
And
to
how about
take them.
family? I mean, do you have a lot of family that attends or goes to the urgent care with a patient also that you work with, or is it many times an individual just comes in by themselves, or a parent?
Often an individual or someone with a child with a parent. Sometimes elderly will come in with children, you know, that are caregiving for them. But since it's ideally not life-threatening, usually the whole family certainly hasn't been called for us to take care of their sinus infection or cough or sprained ankle.
Right. And now, is there a price break? Is there an advantage? I imagine some people would say, well, let's go to the emergency room, but if they go to urgent care, is it more affordable for this maybe a same procedure provided by both organizations?
I suspect that yes, it probably is. As far as copays go, generally an urgent care copay might be more than seeing your family physician, but certainly less than the emergency room.
Okay.
And I would say many insurances favor you not going to the ER because the minute you're in the ER system, you're getting a higher level of care than what normally we would give. And so the many insurance companies favor a lower level of care in an outpatient clinic compared to the ER.
Well, then I imagine, the emergency room is expensive, urgent care has a cost. Would then going to your primary physician be a little bit below that cost also? Maybe be more affordable?
You're asking me questions about insurance companies.
You do medicine, you don't do money.
I couldn't comment on that, really.
Okay.
Yeah.
Well, let's talk about hours then. Of course, the hospital, emergency room open 24 hours a day. The urgent care facilities, are they open, 24 hours a day, 7 days a week?
Thankfully, no. We're open basically 8 to 6 is going to be our standard. We're going to expand our hours mid-June, and we'll be open 8 to 6, 7 days a week.
And I imagine in a place like Montana, you see a lot of sports-related injuries, right?
A few.
That come in,
yeah.
But like, what point does a sports injury warrant going to, say, the hospital emergency room versus an urgent care?
I mean, my very simplistic criteria is if you can walk in to see us, we'll probably appropriate to see urgent care. If you have to be carried off the field and carried into us, probably not appropriate. So big bone injuries, severe shortness of breath, bad concussion, those kind of things, you're probably going to need a higher level of care than what we can provide.
And if someone does come into your facility, you'll redirect them back to the hospital, right?
Absolutely.
That's where they need to be.
Yeah.
Well, let's talk about primary care physicians. It's interesting, a lot of individuals don't have one. And why are they important? Why should they be a part of every individual's healthy lifestyle, I guess?
Well, I'd encourage everybody to get a primary care doc for what I call simple maintenance reasons. And I'm not trying to say their work is simple, but you have to change and make sure your oil level's good and your transmission fluid's up to snuff. And in more literate terms, that has to do with checking your cholesterol, check for diabetes, check for heart disease, check for the routine cancers that are age appropriate. And that's a huge function. We do not provide that function. So you need a primary care doc, a doc of record that would maintain your medicines, do your annual physicals, make sure the medications are working, make sure your labs are okay. And so they play a critical part in I think, health maintenance. I would dare say some of the sicker people we see don't have primary care, and they're sort of what I call crisis mode. They come in when things break, which if they'd have had primary care, they may have intervened earlier and not gotten to the point they are when they see us. We see that quite a bit.
Yeah.
So.
Well, at the urgent cares too, I'm kind of wondering, what kind of individual do you see there? Are you seeing, sports? I imagine sports activities on the weekends are a lot of your clients, but in age groups, are there, to generalize, are you seeing older patients? Or are you seeing younger?
We see the gamut, from babies to geriatrics and everybody in between. It just seems to just depend on the day.
Something new every day, and that's kind of fun for your profession.
I was going to say, that's what gets me out of bed in the morning. I don't have a plan, just go and react to what happens, and that's why I like it.
Okay.
Yeah.
Well, we know what a physician does, but Laura, I'm kind of wondering, sometimes people are not quite sure what a physician assistant does. And then you have, after your name, PA-C. Could you explain to us what a physician assistant is and what the C represents?
A physician assistant is what's called a mid-level provider, similar to a nurse practitioner. The C stands for certified, so physician assistant certified, because CPA was taken by the accountants.
Oh. Okay.
So we are PACs. It is between a nurse and a doctor. When you're going to school, they say that a PA or a nurse practitioner has 75 to 80% of the knowledge that a physician has. So schooling is typically 2 to 3 years, and we're able to deal with most of the routine things. And then if there is something particularly complicated that we have some trouble figuring out, we can certainly go to our physician counterparts.
Okay. Do you have prescription writing privileges? Or?
We do.
Yeah.
Yep, in
And
the
I
state of
must-
Montana.
I must say our urgent care PAs are most excellent. They're top notch. I'm proud to be affiliated with them. So.
Oh, that's good to hear.
Yeah.
Well, I imagine having a physician assistant really helps with the patient load. And the next question, you watch on TV, all the soap operas and different things. There's long wait times to get health care. How are the wait times for urgent care?
Well, it's bone of contention with us, but we're working on it. Right now, it depends on the day, and it depends on the severity of the illnesses we're seeing as to how fast we can go. But our wait times average anywhere from a half an hour to 3 hours, quite honestly. And the hospital administration has been very responsive, and we now have some new manpower coming on board, what I call the third generation PAs. And we're really looking forward to having them. That's going to beef up our staff, which I'm hopeful will decrease our wait times substantially. And also a little education from us as to what's appropriate to come visit us may help with wait times as well. So I'm optimistic. I think hospitals working hard to help us out and increase patient service in general.
That's something they're always monitoring and working to address, and
Absolutely.
the unexpected happens, but I don't think they're as bad as you see on television and these soap operas
I don't
and
know.
things. Don't watch TV, huh?
I don't watch much. I don't get out much. No, I guess not.
That's good. So let's talk a little bit more about what is appropriate. You just mentioned that getting the right patients in with the right conditions for you to see them. Can you reiterate what those conditions are?
Well, I would say first, as a preamble to this, is it's very hard for a patient to read a list of conditions and say, well, I fit in this condition in this column, so I can go to urgent care, or I fit in this condition in this column, so I should go to ER. And I personally would have trouble figuring that out in some cases. So, by definition, the definition is very hard to, but, your usual respiratory illnesses, your non-severe broken bones, ribs, wrists, fingers, ankles, we do a lot of that. If you start getting really sick, bad short of breath, bad abdominal pain, bad chest pain, again, if you're not sure to call an ambulance or what, then you should probably go to the ER. If you feel like you can get around, but you might want to just get it checked out that day somewhere, and you don't feel like you're dying, then we're happy to help.
Happy to help give you. Would you like people to call in, or they just kind of show up and you take care of them?
They just show up.
Yeah.
Yeah. Yeah.
That's the best way.
That's how we operate. Yeah.
Okay. And Laura, can you kind of describe where the 3330 Ptarmigan Way is? For people who haven't been there, how do you get there?
Going up North Montana, you can turn at the light by Target. If you go left, like you were headed towards Bob Ward's.
Head west?
head west,
Yep.
yes, towards
Okay.
Bob Ward's, that would put you at our building.
Okay.
And there is a sign at the side there.
It says
it's-
urgent care. Is there an urgent care sign more towards Montana Avenue that they can spot? I know going down the interstate, you see hospital signs all the
I
time.
don't think that there is. I
I
think it's
think
just on the building.
Once you turn left, like you're heading to Bob Ward's, there is a sign you can see just at the end of the block.
Right in front of you.
Yeah.
And you can go right there. Okay.
Mm-hmm.
Well, no, well, summer's just starting, but kids and maybe parents should start thinking about sports physicals. And Earl, is the urgent care a good place to get a sports physical if you don't have a physician?
It is. You know, the hospital has scheduled sports physical days. Certain days they'll do them. But if you miss those days, then yes, we do sports physicals.
You need to come in, you can do that. I
So,
know we'll be doing a show.
yeah.
We do a show every year about, they have a big event St.
Yeah,
Peter's does,
yeah.
Educate everybody and come
Right.
in and get
Yeah.
those things done.
We do quite a few every fall.
Yep.
So,
That's great. Well, now we're drawing to a close on the show. I'd like to get some of your final thoughts. And Laura, let's start with you. What would you like our viewers to remember about urgent care and how useful it is?
I've worked in urgent care for 15 years, and I have enjoyed it very much. The variety that we see is always fun, but again, not life-threatening things. So if you have sprains or a laceration that's not too bad, or upper respiratory illnesses, ear infections, we are certainly a great place to come for those things, and we are happy to continue serving the community.
You can get that addressed quickly and efficiently, and wait
Yes.
times aren't that long, really, compared to other TV shows.
Yeah.
That's good.
Yes.
And Earl, what are some of your final thoughts about urgent care?
well, I would say urgent care has evolved over the years. It wasn't really a necessary item back when Marcus Welby practiced,
Yeah.
you know, because he had his little black bag and he worked night and day and went to your house and was very involved. But we kind of have gotten more populated, and there aren't enough Marcus Welbys to go around. We have great primary care docs in this town, but they physically can't see everybody, and that's kind of where we come in. And having worked in urgent cares and private practice, we got it pretty good now, I would say. We have x-ray and lab, which is just incredibly great to have right down the hall. You
Yeah.
know. I've worked in the past where I didn't have it within 6 blocks or more, and then you had to run the patient over and back. So, you know, it's a great clinic. I enjoy working there, and we're happy to help.
Yep. And it's amazing the advances medicine has made since Dr.
Yeah.
Welby,
Yeah.
what they have there and what we can access here in Helena and at St. Peter's Hospital. It's just wonderful. But now, can you maybe comment? We can put the St. Peter's number and website up. St. Peter's will help you find a personal physician too, won't they? They have doctors.
They do, and you call that central line and they send you to scheduling. And we have 2 new physicians, family practice physicians, coming on board, and 1 new PA, I think. I hope that's accurate. So the hospital's doing their best to increase manpower there as well to provide the service. So, yeah.
And those physicians will help you get a baseline as to what is healthy for you, because that's different for everybody, right? And
Yep.
they can help you get on a path for better, healthier lifestyle.
Maintenance.
Maintenance.
Yes, exactly.
Maintenance. Well, thank you
Yes.
both for being on the show today. That was wonderful information. I love this. I learned so much. And I know our viewers do too. Thank you for doing it.
You're welcome. Thanks for
welcome.
having us.
And again, viewers, urgent care, we have 2 locations in Helena. We have one at 3330 Parmegan Lane and one at St. Peter's Hospital at the east entrance, kind of on the north side there. And they have over 30,000 people visiting during the year. So it's a popular service. It's a good service that might be just right for you. For the Pulse St. Pete's, I'm Brian Lamore. Thank you for joining us.